All right, let's open the file on a medical mystery that often disguises itself as just a common bug. Today, we're diving into the case of the summer fever. So, picture this. It's the middle of summer, you're enjoying the weather, and then bam, you get hit with what feels exactly like the flu. You probably just chalk it up to bad luck, right? But what if it isn't the flu at all? What if that fever is hiding a much bigger secret? Okay, here are the first clues in our case. It kicks off with all the familiar stuff, a really high fever, those awful body aches. But then, a third, much stranger clue shows up, a mysterious, painless black spot on the skin. And that one little detail, it changes everything. So, every good medical investigation starts with the first few clues, what doctors call the clinical presentation. This is basically the puzzle they have to solve when a patient walks in feeling absolutely terrible, especially during those hot summer months. The thing is, this hits you suddenly. There's no slow buildup. One day you're fine, the next you're just floored by chills, headaches, and a fever that's shooting through the roof. And it all happens about 6 days after you've been exposed, which makes it almost impossible to figure out where you got it from. It's the perfect disguise for our culprit, just pretending to be a simple summer flu. So if it's not the flu, then what in the world is it? Well, every good mystery needs a villain, right? In this case, our bad guy is microscopic. It's time to unmask the agent behind this whole thing. Meet our culprit, Rickettsia connori. It's this tiny little bacterium with a very specific MO. Think of it like a cellular fugitive. It literally can't survive out in the open, so it has to break into and hide inside our body's own cells. And its main target? The cells that line our blood vessels. But it doesn't get there on its own. It uses an accomplice to sneak right past our defenses. You know, what's so fascinating about this timeline is that this mystery wasn't solved overnight. This was a 22-year-long investigation. I mean, think about the technology back then. In 1910, doctors saw the fever but had no way of seeing the cause. It took them 15 years just to connect it to that telltale black spot, the tache noire. Then another 5 years to finger the tick as the getaway driver. And only in 1932 did they finally put a name to the face of the bacterium itself. That is some seriously impressive medical detective work. So we've got our culprit, Rickettsia connori, but how does it actually commit the crime? I mean, how does it get from its hiding place into a person? The answer is all in the bite of its sneaky accomplice. Let's break down how this little criminal operation works. First, you have what's called the reservoir, the dog. This is like the safe house where the bacteria can just hang out, often without even making the dog sick. Then you have the accomplice, the vector, the brown dog tick. This tick bites an infected dog, picks up our microscopic fugitive, and then passes it on to its next victim, which could be a human. And the tick's life cycle shows you exactly why it's such an effective partner in crime. I mean, look at this. To go from a larva to a nymph, it needs a blood meal. To get from a nymph to an adult, it needs another blood meal. And for the adult female to reproduce, yep, one more blood meal. That's 3 separate chances in a single tick's life to either pick up the bacteria or pass it along. They are literally built for this job. Okay, so the bacteria is inside the body. The crime is in progress. Now it's time to look at the evidence it leaves behind. These are the symptoms that help our detectives build the case. For any medical detective trying to figure this out, this right here is the key. Recognizing this classic trio of clues. When you see these 3 things together, that sudden high fever, the signature black spot, and a rash all over the body, the case really starts to crack wide open. And we're not talking about a mild fever. Temperatures spike to a brutal 39 or 40 degrees Celsius. That's 102 to 104 Fahrenheit. This is the kind of debilitating, knock-you-off-your-feet fever that brings the patient and the whole investigation to a grinding halt. Another huge piece of evidence is the rash, but it's kind of a late-arriving witness. It doesn't pop up right away. It's usually about 3 to 4 days after the fever starts that these spots appear. And here's the clincher. The rash often spreads to the palms of the hands and the soles of the feet. That specific detail is a major clue, helping doctors rule out other look-alike illnesses. Now, for most people, the case ends with a full recovery, but this number, 6 to 7%, this is when the illness turns malignant. This is where the investigation suddenly becomes a race against time, as the whole thing goes from serious to potentially life-threatening. So, certain risk factors can make someone much more vulnerable to this severe malignant form. Things like being over 60, having diabetes, alcoholism, a weakened immune system, or this specific condition called G6PD deficiency. All of these raise the stakes. In these patients, the bacteria's targeted attack on the blood vessels escalates into an all-out war, and that can cause systemic damage and even organ failure. So, with all the evidence laid out, how do doctors officially solve the case? Let's get into the final chapters here: the diagnosis and, most importantly, the treatment. This quote right here is key to understanding the detective work involved. Long before any lab test confirms it, the case gets built by connecting the dots. The epidemiological clues are about opportunity. Is it summertime? Is the patient in a known hot zone like the Mediterranean? The clinical signs are the physical evidence: the fever, that spot, the rash. It's all about combining the circumstances with the hard evidence. Believe it or not, doctors sometimes even use a scoring system to build their case. That high fever, the black spot, the rash, they're all worth points. Even just being in the right place at the wrong time adds to the suspicion. But as you can see, the definitive lab confirmation, well, that's the smoking gun. It's worth a massive 25 points. This is how you go from a strong suspicion to being absolutely certain. And here's the good news. Once the culprit is identified, we have the perfect weapons to take it down. The antibiotic doxycycline is the go-to, and it works incredibly well. For specific cases like with kids or during pregnancy, there's josemicin. But the single most important thing here is timing. Getting that antibiotic treatment started early is the absolute key to preventing severe complications and closing the case with a happy ending. Okay, so we've identified the culprit, we understand its methods, and we know the solution. Now for the final and maybe most important chapter: prevention. How do we stop this crime from ever happening in the first place? The prevention strategy is really all about disrupting the criminal operation at every level. First, you control the accomplice, the vector. That means using good tick repellents and doing thorough tick checks on yourself, your kids, and your pets. Second, control the reservoir. Treat your dogs for ticks to deny the bacteria its safe house. And finally, there's personal awareness. Just knowing what to look for, especially if you're in a high-risk region during the summer, is your absolute best defense. And that closes our case. We've taken a mysterious summer flu and we've unmasked its true identity. We know the culprit, the accomplice, the evidence, and the solution. So now, the next time you hear about these clues, you won't just hear about an illness, you'll see a case that's just waiting to be solved. And you'll know exactly what to look for.